My GERD was extremely difficult to diagnose because I'd had it for so long, and I had had the same physician for 10 years who was used to treating my reflux and did not think it could be causing the symptoms that I had. My symptoms started with the heartburn and then progressed to coughing, hoarse, difficulty breathing. Then I was aspirating. Because of the reflux, after I ate, I would cough so severely that it was causing bronchitis, and I was constantly being admitted to the hospital for pneumonia. I've had it all my life. I've taken medication for it all of my life. I was not getting any diagnosis. I was getting sicker, and then was recommended after a second opinion to come to Hancock and see Dr. Heiss. Dr. Heiss diagnosed me immediately, as if it was a no-brainer, why I was so sick. And within 2 weeks of seeing Dr. Heiss, I had surgery and was better almost immediately. I had a TIF procedure with a hiatal hernia repair. Compared to a scope and the Bravo testing, the TIF procedure was minimally invasive and was easy. There was no pain for me compared to the other procedures I had to do to get this procedure. I was so thankful that they were willing to do it, because it wasn't the procedure that I had to be cut open and miss 6 weeks of work, and it was changing my diet, which I had done anyway, and it was finally someone was willing to help me, and Dr. Heiss was willing to do that. And like I said, within 2 weeks of being here, he fixed me. And I was back to being able to lead a normal life with my family again. My care at Hancock Regional, I had been to several other facilities, 2 major networks. So the personalized care was a lot better. It wasn't push me through to another doctor. Dr. Kleinsteiger and Dr. Heiss actually talked. The staff was wonderful. It's a family setting. When I walk into the doctor's office, they know who I am. Even waiting in the waiting room for surgery was joking and comfort. They knew my personality, they knew what I had been through, what it had taken to get me there, and they were just happy to be able to help. I would not only recommend Dr. Heiss, but I would recommend Hancock, because they took the time to listen to me instead of looking at a book. They took a time to see that the GERD had gotten worse, and Dr. Heiss, Dr. Kleinsteiger, Sue, everyone here has been wonderful, and I would say better than the big networks. I think that people look at it as something stigmatized, that it's just reflux. It's just take a pill, but it can get worse. Your immune system gets weak, and it's not just GERD. That reflux takes a toll. That acid coming up your esophagus and into it affects you, and it doesn't go away until you get, like I was, 6 months from dying, all because of GERD. But Dr. Heiss then did the procedure. We scheduled it immediately, and it's been 6 months, and I feel better than I ever have. No meds, no PPIs, nothing. No asthma meds, no inhalers, nothing. And I have been on those since I was 12. It could have been easily fixed with this TIF procedure before it got to this severe case. It was, compared to everything else I had been through, it came in my life. I enjoy food, something that a person with GERD doesn't do. And it was better in 2 weeks.